And now the interpretation of thyroid function test. But first we have to understand some basic concept about what is the meaning of primary in case of hypo or hyperthyroidism, and what is the meaning of secondary in case of hypo and hyperthyroidism. That is, what is the meaning of primary and what is the meaning of secondary in case of hypo and hyperthyroidism. When the problem is within the gland, there is a normal secretion of TRH and TSH from the hypothalamus and pituitary, but the thyroid gland does not respond to the increase or decrease level of TSH. For example, when there is autoimmune destruction of the thyroid gland, when there is an infiltration of the thyroid gland, or when there is any adenoma of the thyroid gland. So when the problem is within the gland, then this is referred as the primary hypothyroidism or primary hyperthyroidism. Secondary, when the problem is in the higher center, that is, problem is in the hypothalamo pituitary axis, when there is disruption of hypothalamus pituitary axis. For example, when there is adenoma, metastasis, infiltration within the pituitary, result in decrease or increase the secretion of TSH, and ultimately there is an increase or decrease the synthesis and release of T3 and T4 level. So primary when the problem is within the gland, and secondary when the problem is in the higher canter, for example hypothalamus pituitary axis. And now the interpretation, what happens when the TSH level is increased, T4 level is decreased and T3 level is decreased. Before proceed to any interpretation, we have to answer the two questions: whether this is of a hyperthyroid condition or whether it is a hypothyroid condition. And second, we have to answer the question whether it is a primary hyper or hypothyroid condition or whether it is a secondary condition. We have to answer these two questions before proceeding to any interpretation. And the classification of the thyroid hormone is typically based on the level of thyroid hormone, that is T3 and T4 level. If the T3 and T4 level are elevated, then we will call it as hyperthyroidism. And conversely, when the T3 and T4 level are lower than the normal, it is termed as hypothyroidism, reflecting the underacting thyroid gland. So in this condition, as the T3 and T4 levels are on the lower side, the T3 and T4 levels are low, this is the condition of hypothyroidism. Whether it is a primary or secondary hypothyroidism, as in this condition, because of decreased T3 and T4 level, the pituitary sense, the higher central sense, this decrease level of T3 and T4 in the periphery, and ultimately increase the production of TRH and increase the production of TSH. As pituitary gland sense the thyroid hormones level in the blood are low, and in response it increase the production and release of TSH. So in this case the pituitary is functioning well. So this is the case of primary hypothyroidism. So increase the level of TSH, unable to stimulate the production of T3 and T4. So problem is within the gland. And now in the second case, the TSH level is low, T3 level are low, and T4 level are low. So similarly, we have to answer whether it is a hyper and hypothyroidism, whether this condition is a primary or secondary hyper and hypothyroidism. As in this case, there is decreased level of T3 and T4. This is definitely a case of hypothyroidism. And we have to answer the second question, that is whether it is a primary or secondary case, as there is a decreased level of TSH also. So as decreased TSH level from the pituitary result in decrease the production of T3 and T4. The linear relationship is seen in this case. So this is the case of secondary hypothyroidism, as decreased level of TSH from the pituitary result in decrease the production of T3 and T4 level. So this is the case of secondary hypothyroidism. In this case, the thyroid gland is functioning well. So problem is in the higher center. In third case scenario, the TSH level is low, T4 level is high, and T3 level is also high. So in third case scenario, as there is increase the level of T3 and T4 level. So this is the case of hyperthyroidism. But we have to answer the second question, that is whether it is primary or secondary, as because of increased level of T4 and T3 level, the hypothalamus and pituitary glands sense the increased level of T3 and T4 in the periphery, resulting decrease the production of TSH, but decrease the production of TSH, unable to decrease the level of T4 and T3. So this is the case of primary hyperthyroidism. As in this case, pituitary is working well, as it decreased the production of TSH in response to increase the level of T3 and T4 level in the periphery. So this is the case of primary hyperthyroidism. And now in the fourth case scenario, we see the TSH is on higher side, the T3 is on higher side, and T4 is also on higher side. So because of increase T3 and T4 level, this is the case of hyperthyroidism. But we have to answer the second question, whether it is secondary or primary hyperthyroidism. As in this case, there is increased production of TSH also. Increased production of TSH result in increase the synthesis and secretion of T3 and T4 level. So as in this case, there is linear relationship present between the pituitary and the thyroid gland. So this is definitely a case of secondary hyperthyroidism. It is also known as the central hyperthyroidism. A pro tip: if TSH, T3 and T4 levels are on same direction, that is, if level of all are decreased or increased, this is always a secondary cause. Now we discuss some unique case where the TSH level is high but T4 and T3 level are normal. Here TSH level is in the higher than the upper limit of normal reference range, but typically it is below the 10 milliunit per liter. As in this case, because of increased level of TSH, there should be increased level of T3 and T4, but here because of increased level of TSH result in normal production of T4 and T3 level. As in this case, pituitary gland is working hard to produce more TSH to stimulate the thyroid gland, but the thyroid gland is struggling to produce the enough thyroid hormones, even though it still manages to keep the circulating level of T3 and T4 within the reference range. So increased level of TSH unable to increase the production of T3 and T4, but thyroid gland here is underworking but still manages to produce the T3, T4 level within normal range. So this is the case of subclinical or borderline hypothyroidism. Similarly, if the TSH level is low and T4 and T3 level are in the normal range, as there is decreased production of TSH from the pituitary gland, but still thyroid gland manages to produce the normal level of T3 and T4 level. So in this case, because of decrease of TSH level, ideally there should be decreased production of T3 and T4 level, but as the thyroid gland starts to over functioning, but in this case the thyroid gland begin to over functioning, and that's why increase the production of T3 and T4 level. But as this is starting off over functioning, so normal levels of T3 and T3 despite low TSH. So this is the case of subclinical or borderline hypothyroidism. Why this is called a subclinical? Because there is no symptom as such present in this case. And why this is called the hypothyroidism or hyperthyroidism? Because in the future this person may develop full-blown hypothyroidism and hyperthyroidism. So this is why we call as subclinical borderline hypothyroidism. Again, in subclinical hypothyroidism, the gland begin to underwork, and in subclinical hyperthyroidism, gland begin to overwork. As it's a starting point, so normal levels maintain. And now let us discuss another unique case where TSH level is normal, T4 is normal, or T3 level is low. This case is already discussed in the part 2 of our lecture series, and this is the case of Sick Euthyroid Syndrome, or also known as low T3 syndrome. Please go to our second lecture on the thyroid series, and where we discuss this case with a case scenario. I hope this is clear, and this is the interpretation of the thyroid function test.